Our healthcare system was really built on dealing with acute problems. As we began to be able to effectively deal with those infectious diseases and people started living longer, that's when we started developing chronic diseases that are really related to lifestyle factors around what people eat, do they smoke, do they get enough physical activity, are they getting the necessary preventive health screening so that we can catch diseases early when they're most treatable and when they're cheapest to treat too, by the way.
Where we're missing the boat in this country on healthcare is we take care of people after the fact, after they become sick, and we don't do enough on the front end to prevent. Where we can really win is now attack the preventative. And you see statistics all over the place about obesity, about heart disease, about the things that are many times lifestyle related, not always, but many times. And if we really put our attention to that, it will support our competitive spirit as well as true competitive place in the world market.
This whole notion of our employees being the most important resources that we have, and that if it were a machine, we would for sure have regular tune-ups. We would invest in preventive maintenance contracts, and there's very few employers, whether it's technology or manufacturing, that I think would let their machines go, and yet we let our human machines go. And so as a consequence, health insurance is seen as an expense that should be cut rather than an investment that needs to be properly deployed.
As an agency, CDC is responsible for providing credible information on what works. We use research studies to inform those recommendations, but it takes a long time for a research study from the beginning of it till several years later when you see it in a scientific journal. We recognize that a lot of good ideas are being developed by people who are doing worksite health promotion in the field. So we wanted to combine our analysis of scientific studies with the wisdom of practitioners who are out in the field, sometimes creating new strategies, building off of scientific ones that have been identified, or inventing new ones. So our SWOT program was a way to have a rapid, credible way of assessing those innovations in worksite health promotion settings.
As we thought about the services that we could provide to American business, one of the things that we did is we actually did a lot of listening and learning, and we talked to American business about what their needs were. And if they could wave their magic wand and get CDC to do anything, what would that look like? And there are really 4 areas that came to the forefront in terms of the kind of services that business thought would be helpful to them. The first is really around assessment and planning for employee health programs. And that's one of the areas where CDC is strong in terms of measurement and figuring out how to utilize data. And so that's an area where we're very willing and eager to provide support. The second is around worker productivity. How can you improve worker productivity by implementing health strategies? And so we're going to begin to think together with business what kinds of strategies would be most effective in order to do that. The third is really around containing costs. Obviously, rising healthcare costs is a really big issue for American business, and they want to make sure that while they're attending to improving their employee health, that they're also taking steps to contain cost. And so we're going to be working again together with business to figure out what are the most effective strategies that they can implement to contain cost. And then lastly, one of the most important ways that you can improve the health of any population is by encouraging their participation in the services and the strategies that you're providing.
Evaluation and assessment are not new concepts to business. In fact, they're really the basis of good business management. If a business starts a new product line or a new service, it's automatic that results are going to be monitored to make sure that new program is on track and that they're getting the results that they intend. It's not any different with worksite health promotion. If you start a new program and you expect it to have a positive impact either on healthcare costs or productivity or employee health, you want to monitor that program to make sure that it's reaching the people that you want, that they're participating in it the way that you expect them to, and that you're getting the results you expect.
The CDC has been a very, very significant part of this whole process. You see, for us to become knowledgeable about the challenges we face with health care and wellness-related issues, we had to draw on a number of resources for information, for data, to really understand what's going on here. Because you've got to understand, we're in a construction business. We're all about concrete and steel and building things. And we're not hands-on practitioners when it comes to health care and wellness and those kind of things.
Our health assessments at Kalamazoo Valley Community College are really an important part, I think, not only of our success, but measuring our success. Twice a year, we ask our employees to come in and have a screening. We're going to avoid the bigger problems by trying to anticipate them earlier.
The annual cost to our budget would be about $170 per participant. That includes 2 health risk appraisals provided by our outside vendor and all the other activities in the wellness program, including the workshops, seminars, and the fitness center utilization.
Lincoln Plating spends about $220 per person on wellness. However, when you look at the return on investment, with our health insurance costs last year for the company as a total were about $880,000, which is about 17% of our overall costs for our overhead. And when we evaluate that as far as the return on investment via the wellness program, here's what we know. We know we come in 50% better than the average company on health care costs per person in the United States on any given year, and we've been able to leverage that. We also know that we saved $1.9 million in 04 and 05 from the wellness program alone, and we're looking at about $2.7 million on this next year, which is an actual line for our company, a plating line. That's what it would cost to put in a plating line.
What we're finding is to invest in the Step Up for Wellness program, we have about 500 employees, and for each of those employees, the cost is about $88 for the year, $2 per week then for each employee. And if you look at that in the realm of all the other expenses that an employer has to face, the $2 a week for each employee is a minor drop in the bucket.
Especially for companies that rely on people to do the work that they're engaged in. There's a need to see people as the resource. They're really the mechanism by which the business gets done. So taking care of that business resource and making sure that it's as healthy and productive as possible is a good business investment. It's good for employees' health, but it's also part of how business gets done. So it's an investment in taking care of this resource that's really the heart of the business.
I've always maintained that if you have a healthy employee, you're going to have an employee that is going to be happy in their job, they're going to be productive, and a productive employee truly is a positive benefit to the employer.
That's what we're all about in this country now, is productivity. So yes, we save $1 in health care, but what's really key is that we're impacting a lot of other areas, like workers' compensation. Costs there are significantly higher. Medical and pharmacy are significantly higher if people have high-risk health behaviors. Disability is higher, absenteeism is higher, presenteeism is higher. All the things that go into forming and making productivity are much greater when people are at high health risk, because they have too many lost work days, too many times out at the doctor, not to mention the money spent. So not only are the healthcare issues paramount, but the fact that productivity is so influenced, I think, is something that business leaders need to recognize as a real plus to them over time.
One of the things that we like to say at CDC is how you think about the problem drives what you do about it. So if you think about approaching your healthcare cost as the driver to address the problem, you will implement strategies that may reduce costs in the short term, but won't help you contain costs in the long term.
Our model, when it comes to health, wellness, safety, is clearly the long-term view. The short-term view would be to figure out how to shift the cost. The long-term view would be how to fix the problem.
When we visited with the CEOs of the 9 small and medium-sized work sites, they gave us many good examples of how they were able to reduce their costs on different things because of their worksite health promotion program. These included things like getting reduced health insurance premiums, reduced workman's compensation classifications that resulted in lower premiums. Some who had renegotiated their cafeteria contracts to be able to provide healthier food options, and the fear was that it would result in lower sales, but actually more people enjoyed the healthy food options and sales went up.
For the last 2 years, when others' healthcare costs have gone up 16, 17, 18%, ours have gone up less than 5%. We're anticipating, for example, as we look at next year's budget, a healthcare cost increase of about 3%. I don't think there are many organizations across the country, or in southwestern Michigan, or in the state of Michigan, that can state that their healthcare costs have gone up only 3% unless they have cut those healthcare costs, which we have not done.
For every dollar that we spend on wellness activities over the past 5 years, we've saved $7 in health plan premium costs, so there's a huge impact in terms of how this program has been successful for us in our organization in affecting those costs. Additionally, our claims experience for workers' comp has been on average about 22% lower in terms of our premium costs for that particular benefit. So other benefits are also being affected, and we feel that that is directly a result of our workplace wellness program.
The cost of health care in this company is substantially less than any other companies in our business in terms of annual increases. Something less than 50% of the national health care cost increases over the last 10 years. That's a reflection on our people. That's a reflection on their behavior. That's a reflection on the fact that they're taking action. That's a reflection of the fact that we're a healthier company today than we were 10 years ago. And so is it paying for itself? Yeah. And is it having some huge benefits? Yes.
Our healthcare costs 5 years ago were in the mode of double-digit increases every year. And that was kind of trending with what the national trends were doing. That's since dropped off to where we're in single-digit growth in terms of our healthcare costs. And there's a lot of factors that influences that. I would tell you that awareness, knowledge, education has certainly helped our employees become better consumers of the healthcare system, and there's clearly some impact on that escalating cost.
Engaging employees is really important, but engagement of employees, I think, really starts at the top. The CEO, the CFOs, the supervisors, the managers need to communicate early and often the how and the why relative to these health promotion programs. The why meaning, why is this important for the business? Employees know that employers are there to make money, and employees go to work so that they in turn can draw a paycheck. But by being healthy, employees can improve their own health for their personal lives, but they can also help the employer achieve its business objectives. And we think it's fundamentally important to explain to employees why these kinds of programs are being put in place.
Communication was an important strategy on a number of levels. We saw it in the signage, for instance, in work sites that promoted worksite health promotion opportunities, prompts to use the stairwells, notices about what kind of classes and activities were going on. We also saw sort of a high-tech communication strategy in several of the work sites so that emails that were tailored to different employees who I had identified different health goals that they wanted to work on could get support from a nurse or a health promotion consultant to help give them relevant information and to keep them on track.
Many companies that try wellness programs and improvement programs, they believe that they can interject this in the middle of the organization or through their human resources organization. And in fact, that could work only if the senior management's on board. Where this needs to be interjected is at the CEO, president level of the company. And they need to walk the talk, be a part of it, and engage the organization, certainly, but they need to lead the way. This is a sensitive subject. And if you have people lower in the organization trying to push a rope uphill, it will not work as fast as it needs to work. So the best way for this to happen is for CEOs and presidents to embrace this and run with it.
From my experience, a health and fitness program has contributed mightily to our increased productivity and is allowing us to make contributions to America's space and aeronautics research programs that's going to benefit all of humankind.
If I had to talk to another business leader and that person asked me, why should I do this? And my response would be very simple. Do you care about your people? You care about your company? You care about your family? Do you believe you can make a difference? Do you call yourself a leader? If the answer is affirmative in every one of those cases, then you have a responsibility to implement these kind of things for the people that you represent every day.
You know, my view of businesses' responsibility for the health of their employees is really, it's a long-term view. Clearly there are immediate needs for providing health care coverage and providing insurance for the employee and taking care of their day-to-day needs. But my view is that we have a responsibility as corporate America to create an environment that helps foster a desire on the behalf of employees to be healthier. If we're all doing this across the country, and we all have programs similar to this, eventually we're going to be a healthier country because of it, because we're creating a lifestyle change for millions of Americans.